will be able to.
They'll be able to conclude.
This list will go down. I'm certain that this list will be pruned down by December.
All right, gentlemen, let's move straight to our next conversation. As Lagos, Nigeria's social and economic hub, continues to benchmark developmental indices in the country, it has been given the task of screening 800,000 residents. This is part of Nigerian Governors Forum initiative, Project 10 Million, to screen 10 million Nigerians for hypertension and diabetes. The project is a nationwide screening that targets 10 million Nigerians across the 36 states and the FCT. The screening, which will run for 7 days, includes tests for blood pressure and blood sugar levels to detect hypertension and diabetes, as well as other measures to assess heart and metabolic health. Now, BBK, let me start with you. What is the idea behind this initiative?
Well, the Governors Forum came together and they identified these ailments as silent killers. They then felt the need to take steps to get people to submit themselves to screening so that they can be helped. Because a lot of people do not even know that they suffer from hypertension.
Sure.
The figures show that more than 8 million Lagosians have high blood pressure and hypertension, and that the prevalence rate is 30%.
Wow.
70% of Lagosians are now aware that they suffer from these ailments. And hypertension causes stroke, it causes heart disease, kidney failure, and to that extent, lack of awareness is a dangerous thing, because these slow killers will creep on you and lead to other ailments like diabetes, obesity, and all that. So Lagos' quota of the 10 million project is what the Lagos state government is trying to make sure that it's able to meet. The plan was to screen 800,000 people within a week as part of its quota, the 10 million Nigerian project. But you and I know that awareness is low.
Sure.
To that extent, getting people to even submit themselves
for the screening
to these tests, it's not as if you are being asked to bring money, but our people would think that, oh, why do I need to do this test? These tests are necessary. That's why, as journalists, for example, the job we do is a pressure cooker kind of job. We have to do these tests regularly.
Sure.
And I'm happy that the Lagos state government, under the leadership of Governor Sanwo-Olu and the capable and world-class Commissioner for Health, are making these tests accessible to our people so that we can save lives. I'm telling you, if they do a test here in TVC, you will discover that some people have even reached the threshold whereby anything can happen to them. You see somebody, they have an argument, he pushes that person on the chest. That person dies. It's because of conditions like this. So I'm happy that this is being done. I say kudos to the state government on that.
Awareness. 70% of people are not even aware that they have this. So what do you have to say concerning this initiative?
Well, first of all, I think investment in health is the greatest thing any government can do for the people. It's far more important than building bridges, roads, industry, because if you build those things, you are going to need human beings to work there.
Sure.
So health is wealth.
Sure.
So I think that investment in health is the greatest form of sustainable development. So I'm happy with what is going on. Lack of awareness is a major problem, not just among Nigerians, but even among public health workers.
Okay.
I'm telling you, you know, Nigerians are used to traditional ways of doing things. We are also superstitious. You know, we believe that, you know, nothing can happen to me as long as I go to church, I go to mosque, I fast, I do vigil. You know, and the fact of the matter is that for every problem, God has provided a solution, not necessarily through prayers.
Yes.
Okay.
That's why God has created cesarean operation, that when it's you have it difficult to a woman to give birth, you go operation. Panadol for headache.
And Luke was even a physician.
Yes, a physician. But our people are so superstitious to the point of ignorance.
Yes.
You know, that they just think that, look, I don't even want to go for that check because, oh, God is with me, I don't want to go for that check. But that's the greatest form of ignorance.
Ignorance.
When you are ill, even doctors, I mean, our pastors, they go to hospital.
True.
They take their children to hospital. So if it's normal thing for you to do medical checkup. When you do medical checkup, you'll be able to know what kind of medicine you need to use or not. And when I was talking about medical ignorance on part of medical workers, I've been to hospital in the past, and when nobody cares where you're coming from. Okay, let me test your BP. But the rule is that when you want to do your BP, you need to rest for about 20 to 30 minutes. So if you are not meeting somebody who's well trained, and I just come after having trekked for about half a kilometer, and just put this, it will give you a wrong reading.
Exactly.
And then you start using amlodipine and all that, killing yourself without knowing that. So I think the health workers need to be well trained, and then there should be awareness about nutrition. Most of the time, what we eat is the major cause of our.
But anyway, we'll get to know more of that as we're joining us via Zoom for more insights on this initiative. Is the Permanent Secretary in the Lagos State Ministry of Health, Dr. Olusegun Ogbeye. Now, thank you so much for joining us, sir. Hello, Doctor. Are you with us?
Yes, I'm with you. I can hear you.
Okay, all right. Let's begin the conversation. The idea behind this initiative. Tell us more.
Okay, basically, what we found is with COVID and Ebola and everything that's happened recently, there's been a lot of focus on infectious diseases, and there's been a little neglect of the non-communicable diseases. And we found that those are actually causing more mortality and morbidity amongst the people. So the whole point of it, when the Commissioners Forum got together, was to see how to bring a lot of attention back to the NCDs to ensure that people are aware of the risk they're running to their health. And because a lot of these non-communicable diseases, especially hypertension and diabetes that we're testing during this 10 million man testing, a lot of them there are things that can be prevented largely through lifestyle changes and through just generally checking your numbers. So the point is to make people more aware about these diseases, aware of the importance of knowing their numbers and doing something about it, and then to ensure that they have access to a place where they can get the tests done.
How far have you gone with achieving your mandate as a state? I know this is a national thing, but all eyes are on Lagos State. How far have you gone? How much cooperation are you getting from the ordinary Lagosian to ensure that you achieve your mandate?
We're getting quite a lot of cooperation. It started a bit slow. Initially, the program was supposed to be for a week, but obviously we were falling behind the target, and it's been extended by another 2 weeks. But now things are picking up. The logistics are working better. We've enrolled more of our primary health centers in the program. Our general hospitals are on board, and we're also now working with quite a few more of the private hospitals to ensure that they test people and we get the numbers from them. And of course, there's a massive public awareness campaign going on now, which is part of the reason why I am on this program, to let people know that this is going on, and also to re-emphasize the importance of knowing about these twin silent killers of hypertension and diabetes.
Doctor, in the past, we used to see these ailments as ailments for old people. But we are hearing stories that kids as young as 9 years are becoming diabetic and they are having hypertension. What could be responsible for this?
Well, there's always been type 1 diabetes, which can occur in kids, but type 2 diabetes, which is the one we're really talking about testing, is more of a disease that occurs in older people. But then back to what your actual question, I think it's more down to lifestyles. In the much older days, I think a lot of our people probably did a lot of walking around to places, did a lot of walking on farms, a lot of more physical lifestyles. But now people just sit at desks. People eat very, very unhealthy food. There's a proliferation of fast foods out there. So I think because of lifestyles and poor nutrition, a lot of people are actually falling to these diseases earlier on in their lives than it used to happen.
All right. Apart from screening, do you offer treatments, most especially for those who can't afford it? Are you just screening, or is there treatment as well?
Well, basically, in this program, it's mainly a test and refer. We refer to our own hospitals for treatment. But then this is also an opportunity to get a lot of people on health insurance. If you pay for health insurance, then if you do have any illness, it's much cheaper to get it treated. So we're hoping that a lot of people, when they know these numbers as well, we can also help them change their attitude towards health seeking by getting them on health insurance. And to also say that the state health insurance program will recruit people, will put people on health insurance for free if they can confirm that they are indigent people, that they're vulnerable. They will put them on free health insurance. And so, of course, they can get access to free treatment, and which would include getting their drugs every month for free.
So where are people being screened? Where have you set up facilities for this?
Basically, the idea is to get screened at any of our secondary health facilities. We have 30 of them, and our PHCs that we have about at least 300 of them. And then, like I said, we've also engaged the AGPMP, the private and general physicians, so that in some of the participating private hospitals, they can also do this screening. And in exchange for that, we will be providing test strips for them.
Yeah, doctor, did you have a mobile clinic? And then did you have any special way designed to reach out to people living with disabilities?
Well, we are not selectively targeting people with disabilities, but then if they also go to any of our health facilities, as we've stated, they will get access. But just to add that we are doing a few outreaches as well, but that is not the main strategy that we're using. But yes, we are doing a few strategies in communities around the state. But like I said, the idea is mostly to get people to go into the health facilities. Because like as I said earlier, the point is to get them to change their health-seeking behavior and be more likely to use health facilities and also be more likely to get on the health insurance train.
All right, doctor, what is the criteria for the screening? And also tell us, what's the process involved?
Well, basically, it's an all-common screening for now. I mean, of course, the priority will be older people who are more at risk. But the priority, the strategy is to screen everyone that comes into a health facility for both hypertension and diabetes. And those that have results that require a second look or results that show that they are very likely to have either of the two diseases, to refer them for definitive treatment.
Would you consider incentivizing this, given the fact that our people are sometimes lukewarm about even things that directly concern them? And how do we generally remove the barriers to regular checks?
Okay, to tell you the truth, incentivizing this kind of thing will hardly ever work, because it then becomes sometimes a perverse incentive. And then you get people coming over and over again using different names, and people who won't change their behavior. Incentivizing it isn't going to achieve the main objective of this strategy. So the point is to, through the public awareness and the engagement in all our local governments, through our because now we have permanent secretaries in all our health districts. The PHCs have been divided into districts, and so they are also working hard to ensure that people get access to this.
And also, how long is this campaign going to run? Is it until when you hit the 800,000 mark? That's when you stop? Or you plan to go above the 800,000 mark?
Well, we intend to continue for another 2 weeks in the first instance, regardless of what number we don't intend to stop if we hit the 800,000 mark.
All right, thank you so much. Thank you so much, Doctor. Thank you so much, Dr. Ray. Appreciate it. Dr. Ray is the Permanent Secretary in the Lagos State Ministry of Health. Thank you so much for joining us on Journalist Hangout.
Thank you. Thank you. My pleasure.
All right, BK, you have something to add to this?
No, I think this is one of the best pieces of news that I've received in a long time. And I just hope that the initiative is properly implemented because it will go a long way to save lives. And last week, too, we heard about the decision to now give a cesarean section, make it free in our country, as announced by the coordinating minister of health. I hope that we can also implement that fully because it's a very laudable initiative. Cesarean section is very expensive in our country.
Yes.
Some hospitals charge as much as 400,000 or 500,000 for it. So if we can let it get to the most vulnerable in our communities, then the government will have taken a big step in ensuring access to Medicare for everyone.
And earlier, do you think this initiative is expected to address the general health concern in the country?
This is a milestone.
It's a milestone?
Yeah, in public health service. And I think it should be continuous. The government needs to devise means of continuing the project. Like I said, the most important investment is in public health.
True.
Look at malaria. That takes about 200,000 lives every day. You know, countries like Egypt was certified malaria-free just this year, October. Argentina has eliminated malaria. Cuba eliminated malaria. England used to have malaria until 1963. They wiped it off. Imagine in Nigeria, we are losing 200,000 people every year to malaria. So we need to invest not just in palliatives, but what can keep people alive to live a long time so as to increase life expectancy of Nigerians that is presently within the age of 45, 46, 47.
I would have preferred maybe they should increase it instead of hypertension and diabetes, include more, more.
Yeah, it's a good place to start. But I think malaria should also be, we need to tackle malaria headlong.
Exactly. All right, let's move straight to our next conversation. As Nigeria seeks stability in the fuel supply chain, more